Good morning, everyone. Thank you so much for joining us, whether from home or the office. This is Kathy Hopkins, and I help coordinate the webinars for Hausman Johnson Insurance. I'd like to welcome you to today's webinar, Compliance and Affordable Care Update for March 2020, presented by Pat Kelly. Just a reminder that this webinar is interactive and will feature a question and answer session. You can type a question in during the webinar, and Pat will address it. After the webinar is over, there's a short survey we are hoping you can fill out for us to give us feedback on the webinar and webinar topics you are interested in learning more about. This webinar will be recorded and will be available on the webinar archive section of our website. Each attendee is going to receive a follow-up email with a link to the recording and the presentation slides. I'd like to introduce you to our speaker, Pat Kelly. Pat has been with Hausman Johnson Insurance since 2011 and has over 30 years of experience with employee benefits. He is very passionate about building a relationship with clients beyond just being a product vendor. He forms client connections through honest communication, continuous education, and always doing what he says he is going to do. Pat works with employers of all sizes and with both fully insured and self-funded medical clients, including defined contribution, HRA, HSA, and FSA. He works with clients on their disability, life, dental, and vision needs. A special note about today's webinar, we are aware that you may have questions about COVID-19. Since there are so much material that Pat is going to get through on the ACA update, we are asking that you save those questions for the end. He will also be addressing the most recent bills that are being put into motion on both the federal and local levels. Welcome, Pat.
Thank you. Thank you, Cassie. And as Cassie said, this is an ACA update webinar. I feel like the ACA, though, has been kind of put off to the side in the last month or so, and rightfully so, with all that everybody has to deal with the COVID-19. But we're well aware that the Senate also passed the Family's First Corona Response Act late yesterday, last night. Still waiting for Trump to sign the bill. Once that's signed, then we will definitely be getting information out on the bill and opinions on it and so forth. But just remind everybody, the bill does not take effect for 15 days after it's signed by Trump. So there's going to be a waiting period there before it actually takes effect. And also, we do know that Wisconsin Governor Evers is looking to relax some rules on the unemployment insurance compensation. What we're hearing is they want to relax the 1-week waiting period before you're eligible for unemployment compensation, and they're looking to relax the rules on the requirement for people on unemployment compensation to be looking for other work. So those are the two things they're looking to relax. But I checked the state's unemployment insurance website this morning, and nothing's been updated noting that. So again, those are things that we're hearing, and as soon as we have confirmation, we'll be getting those out to all, and we'll also be adding that to our website, which we have a good Q&A and resource piece on our website on obviously the virus and what's going on. So that said, let's start the webinar on the ACA. The agenda, we're going to talk about the spending bill repeal, the fact that the PCORI fees are reinstated, other states, although the federal individual mandate technically is still there, but the penalty is zero. Other states now have enacted their own mandates, and there's some things that employers need to be doing for employees in those states. Individual coverage health reimbursement arrangement is something new that was out there, effective as of the 1st of this year. Obviously, large employer penalty updates, IRS notification updates. I always throw in health savings accounts because those change every year. Other notices are not ACA, but CHIP notice and so forth. The EEOC and the DOL information on workplace wellness programs, and then small employer coverage, individual mandate, what's going on with association health plans, short-term limited coverage, and then kind of looking ahead, what's going out, what are we hearing out there on the ACA, looking ahead federally wise. So the big thing here, the spending bill for this year repealed some ACA fees and taxes. The big one here, this really is the big one because the Cadillac tax is repealed beginning this year. It was never effective, so it was never implemented, but it held a pretty good scare tactic over a lot of health plans because it was going to be a 40% excise tax. So that's gone. So we don't have to worry about that anymore. The other bill that's gone that hasn't really been applied since 2016 is the medical device tax. That was at 2.3% excise tax on medical devices. Obviously, does that affect health insurance? Sure, because if you need a new knee or you need a CPAP machine and the cost has increased 2.3%, we know where that gets passed on to and so forth. The big piece that has been repealed, now it's not repealed for 2020, this is going to be 2021, is the health insurance provider fee that was applied on health insurance providers from the ACA, and that's huge. For the last 4 years, it's been on and off. It's on this year for 2020. It was off for 19. It was on for 18. Off for 17. But when it was on, it's costly. Anywhere from typically we were seeing 1.5%, 4% added to premiums due to that tax that insurers had to pay. So that's going to be gone at the end of this year. So as groups that renewed January 1st of 2020, yes, it was included for the full year. You won't see it next year. Obviously, groups that are renewing March, April, May, June, July, that will be included, but it'll be prorated, just obviously to catch up, for this year and so forth, because it was probably included, part of it was included in your renewal last year because they knew it was going to apply and so forth. But good news, it's gone. What's back, though, is the Corey fee. That was reinstated, and it was supposed to end for employers that had plan years of October. Something got black. Never mind. For plan years that ended before October 1st of 2019. So that was supposed to be pretty much gone. Well, that now has been enacted, and that's going to be extended through 2029. So that's the fee that employers that are self-funded pay, employers that have fully insured plans, but they have a health reimbursement attached. There's a fee on that. The insurance carrier that's providing the fully insured coverage, they pay this fee. So that's going to go on, obviously, for about another, until 2029. And that's paid every July 31st on the IRS Form 720. I think everybody has been paying it, familiar with it. At this point in time, we don't have what the fee is going to be for this year. That hasn't been indicated yet, but obviously as soon as we know what that fee is, we reach out to everybody and get them the information on that and so forth. State, this is something that we're finding a lot of people aren't aware of, but the federal mandate's gone. So there's no, again, I don't like to say it's gone because typically it's still there. But what's gone is the penalty for the federal individual mandate. If someone does not buy individual health insurance, they don't get a penalty anymore. But certain states have enacted that penalty. We always know Massachusetts, they've had theirs since 2010 or 11, I believe. But other states have enacted a penalty. Two that are active right now, D.C. is not a state, but they have a penalty. They're providing, individuals that reside in D.C. Don't have health insurance. There's an individual penalty. And so has New Jersey. And they enacted that for 2019. So what they are required is all employers need to file with the state of New Jersey the 1095 form. And that's, so that the state knows that individual has health insurance. So if you have fully insured coverage, it's the 1095B form that goes to the state. And we've checked with just about all our carriers, and they are sending that form to the state. But then there's a 1095B form that small employers, those that have less than 50 employees, need to provide if they provide self-funded coverage. Check with, if you're a small employer, you have you're less than 50 FTEs, full-time equivalents, this form needs to be filed with the state of New Jersey. And then for large employers who are filing the 1095C to show who has coverage, that needs to be sent to the state of New Jersey. Obviously, it must be mailed to residents by March 2nd. Well, pretty much all you've already done that. You're because of the federal mandate on getting the 1095C out. But you might not have done that on the 1095B and so forth. You need to check that. But it must be submitted to the state of New Jersey electronically only by March 31st. And the site that they're using is the site that you would use to file W-2s to the state of New Jersey for employees that live in the state of New Jersey. And you have to do it whether there's one or you got 100 there. You have to file with that form with the state of New Jersey due to their individual mandate requirements and so forth. Obviously, contact me by email if you have any questions or you need help with that site, on where to file and so forth. And then there's other states that are also looking or have already enacted individual mandates, but they're for you don't need to file this year. You'd be filing next year. I know I have a little piece on DC up here, but I think I've covered it. So again, their law is for 50 full-time employees and at least one DC resident, and that you need to file by June 30th. If you have employees in DC that have health insurance coverage through your group plan. The other states that have currently enacted individual mandate, this is for 2020, are California, Rhode Island, and Vermont. So, there are others to follow as well. So even though the federal mandate's gone, as I say, you got to know if you have employees in other states, what they're doing if they have an individual mandate and what requirements they have of employers to notify the state that individuals have coverage and so forth. Starting in 2021, we have a new summary benefits of coverage. SBC is kind of our acronym that we throw around out there for that. That's that 8 or 9 page SBC that the ACA requires employers to make available to employees. There's a new template for 2021. So it needs for January 1 effective dates, of 2021 and later. This needs to be updated and must be used for open enrollment with your plan. So really we're telling you self-funded plan sponsors should ensure they are using the new template. So you can check with your TPA. You can check with us. We've already checked with the TPAs and they're on top of this that we work with. And same thing, fully insured employers should check with their carrier to ensure they're providing the updated template. And again, we've reached out to our employers that are fully insured carriers, and they're well aware of this, and they should have everything ready to go by your open enrollments for 2021. Talk a little bit about a new HRA out there. Many of you might be aware of this, some not, but effective January 1st of 2020, the current administration is now allowing for employers to pay for individual health insurance through an individual coverage health reimbursement arrangement. Prior to that date, there were very strict penalties if employers used employer dollars paid for individual health insurance. The ACA strictly forbid that, and now with our current administration, they signed a law called Again, it's got an acronym, we call it the ICHRA, the ICHRA, that stands for Individual Coverage Health Reimbursement Arrangement. It does allow employers to use employer dollars through an HRA to reimburse them for their individual health coverage and so forth. We haven't seen a huge adoption yet. They're new. There's a lot of, just like anything else, there's a lot of paperwork. There's a lot of notices that employers have to do. We're not seeing yet too many employers drop plans to move to this type of a way to help employees pay for their health insurance. Will we? Possibly. Where we've seen interest is, especially in our world here, everybody in our greater Madison area and the surrounding communities are mostly covered by an HMO. The employer provides HMO coverage. They have one employee in another state that is on a PPO. And typically, our HMO, PPO plans are usually more costly because than what an individual could probably buy through their own in their own local community. There we're seeing some adaption. Some people looking at adding these, but it's very restrictive on doing that. If you can comply, it's great. If not, there's some tough rules. But key things with this, employers cannot offer employees a choice between the individual coverage HRA and a traditional group health plan. Okay, so it must offer on same terms to all employees within a class of employees. So you can class out employees, and I'll talk about that in a little bit, but if I'm working here at Hausman Johnson and I have an offer of group health insurance, they can also say, well, if you'd like, you can also go out and buy your own coverage either in the open market or on the marketplace, and we'll reimburse those premiums. I can't have both offers. I can have one or the other. And like I said, there's an annual notice that employers need to provide to employees that, not the easiest to comply with and so forth. You have to have substantiation requirements. You have to have employee classes if you're going to break them out. And there's also contribution rules on how much you can contribute and so forth, based on someone's age and so forth. So the minimum class size, if you're looking to break this out, like let's say you want to offer the plan to, and again, with everything that's going on right now, we're probably not going to see this, but prior to all the coronavirus, we've had employers say, hey, we have a hard time keeping part-time employees. We don't want to provide a regular benefit that we provide to full-time employees, but what if we want to help employees out, throw them $100 a month to help buy individual coverage? Part-time's a class, it could have been used for that type of class. Or we've had groups say, well, what about hourly versus salary, things like that. Those are legitimate classes and so forth to be able to offer this. But even if you set up a class, if you have less than 100 employees, there has to be 10 employees in that class, not covered, but in that class and eligible through that class. So, you got to make sure you've got at least 10 in that class. You can't, obviously if you only have 5 in the class, you can't provide the HRA. If you have between 100 and 200 employees, it's 10% of your employee number. And then if you have greater than 200 employees, there have to be 20 in that class to be able to offer individual coverage HRA alongside another group health plan and so forth. The maximum dollar, there is no maximum dollar amount on how much you can pay. I mean, if you want to pay 100% of an insurance premium, you can do that. But with individual plans out there, maybe we don't know this, but they're age rated. So someone who's 25 has a different rate than someone who's 64, obviously. And these rates go up every year. So the maximum dollar amount made available to the oldest participant on these programs is limited to 3 times the dollar amount available for the youngest participant. I'm kind of making a point of this because the actual rates are set at 1 to 5 times. So Pat being 64, my rate can't be more than 5 times higher than the lowest rate that they offer, which is typically, other than young kids. I think right now the lowest rate that we have rate bands for is 15. So, whatever that rate is, my rate can't be, can be 5 times higher. But the HRA is limited to 3 times. So that kind of creates pressure on older people where, if you want to pay, let's say, try to figure out 30% of the premium for everybody, that's not going to work because my 30% could be 5 times higher than the youngest person on the plan, and it can only be 3 times. So, that creates some concerns there, obviously. And the applicable, if you're a large employer, the shared responsibility rules apply to these programs. We're starting to see, there is legislation out there on how you can make sure the plan is affordable, but obviously, you have to make sure it meets the affordability guidelines. And I have another slide on that you have to meet currently for your employees on your group health plan, or obviously you're subject to potential penalty, large employer penalties and so forth. Speaking of large employer penalty and affordability update, the penalties for 2020 are listed, and I've still got 19, 18, 17 there. Now, these are all indexed. So when we started this all out, the penalty was 2,000 and 3,000 potential penalty for large employers. Again, the 2,000 penalty is what we call the A penalty. That's if you don't provide coverage to more than 95% of your employees, you could potentially be subject to that A penalty. And the $3,000 penalty is if you satisfy the requirements of the A penalty, but you don't offer affordable coverage, that would be a penalty for each individual that goes to the marketplace and qualifies for premium subsidies or cost-sharing subsidies. That would be that penalty back to you. And again, these are prorated for the amount of months that that individual, had that individual coverage. So 2020, if you provide unaffordable coverage, or no coverage at all, or you don't provide the coverage to 95% of your employees, that penalty is $2,570 times how many employees. And again, they do give you a break on 30 employees. So if you have 100 employees, you subtract 30 from that number, you'd have the 100, 70 times that amount, but then again, it would be prorated monthly. And if you provided to 95% of your employees, or it's not affordable, then obviously we have that amount of potentially $3,860 per employee. And again, that would be for the employee if they actually get a marketplace subsidy or a tax credit. And we have 19, 18, and 17 up there because right now employers have been getting letters of notice of potential penalty for 2017. So the IRS is still obviously catching up on the penalties. The affordability, how do you figure if your plan is affordable or not? For 2020, if the individual coverage costs more than 9.78% of that individual's income, then it's unaffordable. So that's the number this year. For 2019 is 9.86, and 2018 was 9.56. And again, depending on what your renewal is, you might be on the year, you might be working off of 2 of these numbers. So if your plan renews in July of 2020, your affordability guideline for the first for 6 months of the year or 7 months of the year would be 9.86, and then you got to change that to 9.78 once you renew in 2020, so forth. And I think most people are used to working with these numbers and that. And we have affordability calculators we can always provide to members if they're concerned. We have, quite a few employers that base their costs off of or have a cost for the employee for the lowest cost coverage that's lower than what the federal poverty level safe harbor is. So I like to include this. So if you want to be sure that you're guaranteed you can't get a penalty In 2019, if the employee cost was $99.75 or lower, they could never that could never be a penalty to the employer because you're actually lower than the federal poverty level safe harbor. And for 2020, or as you renew, that goes to 101.79. So if the plan doesn't cost more than 101.79 to the individual for your lowest cost plan, then again you comply with the federal poverty level safe harbor, and that's one way to definitely make sure you would not have a penalty for your for your members that are eligible for coverage, as long as you provide it to 95% or more of them and so forth. So that's kind of how that works. The next slide is kind of talk about large employer, still a large employer penalty affordability update, but also I added this in here because of what's going on with the COVID virus and the fact that unfortunately, many employers, especially those in the food service industry, we know, the hotel and hospitality and other issues, are laying off employees or reducing hours. And I just want to remind everybody that if you are tracking employee eligibility using the look-back measurement method, and you need to reduce hours from full-time to part-time, and you terminate their coverage off of COBRA while in the stability period, then this could possibly subject you to a large employer penalty. Okay, I want to make sure that if you have employees, and it's typically the employees that most employers track are hourly employees. So if you're tracking hourly employees to determine their eligibility using the look-back measurement method, and they've been with you through one full measurement method, whether you use 6 months or 12 months, I think most employers use in 12 months, they're in a stability period. And the stability period says, as long as they're an active employee, even though you reduce their hours, you have to keep paying, you have to keep the employer contribution to that coverage the same. Now, you have to, you don't have to, but if you want to avoid a potential penalty, that you have to keep them on the coverage and keep paying their premium the same while they're in a stability period. So if you actually terminate their coverage, you can do that and offer COBRA. If that member were to go out to the marketplace and qualify for a tax credit or cost-sharing subsidy, that would be a potential penalty back to you as the employer for the months that they would be under that stability period of coverage and so forth. So just want to remind people that, these are tough times, but if you're going to put people to part-time hours and they're in that stability period, that you could have that potential concern. Okay, how does the IRS get to employers to let them know that there is a potential penalty concern? This doesn't come from the IRS, this comes from the marketplace, but there's a notification of individual subsidy. It's called Section 1411 certifications. You're supposed to be getting this from the marketplace when an individual qualifies for a subsidy and they indicate that they're an employee at your place of business. These were out the first year they did this. I don't know if these are being sent out. We're hearing that nobody's really receiving them, and to me that's odd because people are qualifying for subsidies and they may, list an employer. So technically they're supposed to go to you, so if you get one, if you start sending them again, you have 90 days to appeal these. If you feel the employee is not due a subsidy, my memory is a lot of people got these and employees said they worked for you and they never worked for you. They stopped working for you a year before, or they were part-time. As we remember, 5 years ago now, when all this kind of came into fruition with everybody, it was all on the honor system. So there was a lot of stuff that was being sent out that wasn't true. We say if you get these letters, it's in the best interest of the employee that you do appeal it. The marketplace is not the one that determines that you get a penalty. The IRS does. But if the IRS says you owe a penalty and then you prove that you don't, this member may have gotten, a subsidy, and they'll have to repay it. So, if you do appeal it early on, then it may be less hardship for them when they have to repay something a year or two later, and so forth. And for the notifications, these are definitely still going out. That's the letter 226J. That's the letter that gets sent to you, notifying you, and it's from the IRS, and it's notifying you that you do have a potential penalty situation, and you have to either decide you agree with it, you pay it, or you don't agree, and then you're going to provide the information as to why you don't feel you need to pay it. So again, one thing I like to note is make sure you reply by the date that's highlighted on the letter. Other thing you will notice is the penalty amount, and sometimes they're pretty eye-opening, and so forth. I think to date, less than one of our clients has told us we got the penalty and we're going to pay it. I don't think we've had anybody yet have to pay a penalty that got the letter. Sometimes they get the letter just because something wasn't filled out right, they correct it, and we're good to go. Or sometimes the IRS misses something and they send a letter, and we read it and say, well, they missed this, so send it back, and we've been good to go. So keep knocking on wood for that and so forth. So really, if you agree, you just check that you agree and indicate payment method, or if you disagree, obviously check disagree and send a letter back with the reason why you disagree and so forth. One thing we do recommend, don't go alone on this. We've helped many of our clients through this. You get help from us, third party or legal. It never hurts to get legal involved. If you do get legal involved, I would recommend practicing benefits or a risk attorney, because there could be matters that you need to discuss with them. And if you hire them, then you have client-attorney privilege. Anything you tell me, for some reason something goes to court, I have to spill my guts. So we've helped a lot of people. We don't think they've had to go to legal, but that said, depending on the situation, you might want to do that as well. So, and the IRS has also contacted employers that they believe should have been filing these because they have 50 or more full-time equivalent employees, and they have not. So these are also very important to respond to. We don't get a lot of them, but we've had people contact us that were our client that had more than 50 employees and didn't even provide health insurance. That's come up, and technically whether you provide health insurance or not, if you're a large employer with more than 50 full-time equivalents, you have to do this. So just want to touch base on health savings accounts. For 2020, the minimum deductible increased up to $1,400 for single coverage, $2,800 for family. So that's the minimum deductible your plan must have that people need to pay before the plan can kick in and start covering. Again, you can have no offers or drug copays without satisfying the deductible first. And there is an exception on ACA preventive care. Now, it's always been covered at 100%. One thing with that is maybe many have seen this, but with COVID, the COVID-19 testing has also been added, and the testing and the office call for the testing is covered 100%. Obviously, if you get sick because of it, that's different, but the IRS is allowing those things to be the office call and the testing for the office call to be covered 100%. And many carriers have also are now allowing, you got to check with your carrier because not all are doing this, but there's also some chronic condition medications that have been added by the ACA to this preventive care list. And these are medications that deal with diabetes, hypertension, high blood pressure, asthma, allergies. You need to check with your carrier to see if they're offering this, and then obviously you need to check with the carrier's drug list to see, okay, what medications are picked up under this, because the ACA allowed these types of medications to be covered on by all plans, and including high deductible plans that qualify people to contribute to health savings accounts. So the maximum out of pocket one person can have with their high deductible health plan is $6,900 if you have single coverage, and $13,800 for family. HSA contributions went up this year. They're now $3,550 if you have single coverage. You can contribute $7,100 for family, and age 55 and over contribution catch-up is still at $1,000. What we're seeing kind of out there is we're seeing more employers moving to or adding HSA qualified plans as a second or third option. We've seen that ramp up quite a bit in our marketplace. Other marketplaces, that's all they offer, but obviously, and here with our HMOs and our South Central Wisconsin, a lot of employers are still offering another plan option with office copays, drug copays, and then adding a qualified plan to give people that want to put money away for future use the right to do that. And if you have a medical FSA, it could be very complex for members moving from an FSA to an HSA. So another thing there, work with us on that. Obviously, if you're looking to add an HSA, you have an FSA, we'll cover the guidelines and we'll cover the complications that we could run into for members that are contributing to a flexible spending account, a medical flexible spending account. Something that's been updated, the Department of Labor has come out with a new model CHIP notice. It was current as of January 31st, 2020. We're just recommending employers should start using this new notice immediately in your new hire package for all employees, and any materials that update employees on health plan eligibility, open enrollment, and so forth, and summary plan description. It's just a new one out there. You should start using it. If you don't have that or have not seen that, I know we've mailed it out, but I know sometimes emails go. Just contact us and we can get you that new CHIP notice. Workplace wellness, the Department of Labor and the EEOC. This has kind of been going on now for about 3 years that the EEOC got involved in trying to regulate what employers can do in regards to incentives or disincentives, however you want to call it, with employers, employees that do or do not comply with workplace wellness rules. We're waiting to hear from the EEOC on if they're going to what they're going to do with the 30% rule and difference in health premium for those who participate and don't. It's not out there yet. So really, this could be a whole webinar. And up here, we have a legal group that we participate with. They do a webinar on this every year. So I have up here the past webinar was last August 14th, 2019. We have it in our webinar archive on our website, and there's also going to be a new webinar. It's already set, and you can go on our website and you can sign up for that on our website as well if you want to listen for the one coming up August of 2020. But really what it deals around, EEOC says workplace wellness that asks medical questions have to be voluntary. You can't force people to do that. And where they're hinging on is the 30% difference in premium. Is that voluntary or not? To someone who makes a very high income, that could be voluntary. They have to pay 30% more on their health insurance because maybe they don't comply on the workplace wellness procedures that a firm sets up. But for someone that makes $12, $13, $15 an hour or more, that 30% could be huge, and that might not be considered voluntary, and that's where the EEOC stepped in on, and that's kind of what we're waiting to have them say, what's voluntary and what's not voluntary for the most part. Small employer coverage, this can's been kicked down the road another year, so as we know it today, a lot of small employers have stayed with their plans that they had that were in force prior to 2015, where employers are going to be forced to community-rated small employer plans that were supposed to, they're out there today and so forth. Many employers now have those plans. But if you have your transitional coverage, or what we call grandmother, you can now renew that up through October 1st of 2021. And based on the way the rule reads, all small employers must come into compliance by January 1st, 2022. So it's just basically small employers that options to kick down the road another year and so forth. The individual mandate just still in force. I talked about this earlier. So the zeroing out of the individual mandate has no effect on the employer mandate in last year and beyond. So the ACA has not been repealed. So an employer receiving a marketplace premium tax credit is what triggers the employer shared responsibility penalty, not the fact that it's been zeroed out and so forth. Association plans, they were in effect of 2019 for eligibility. Again, we haven't seen a huge movement in Wisconsin on them. The only two association health plans I see is one, they're both underwritten by United Healthcare. They're both fully insured plans. One is the Wisconsin Manufacturers of Commerce, and the other is the Wisconsin Bakers Association. I know the Wisconsin Manufacturers of Commerce had their plan. They stopped with it for a while, and they brought it back. They redesigned it a bit to try to make it more attractive, more cost-effective, and so forth. They're out there, and those are the only two I know of. Still, Wisconsin Commissioner of Insurance has very strict guidelines on self-funded association plans. So I don't see any of those really popping up in Wisconsin unless those rules would be relaxed. Same thing with short-term limited duration insurance. A lot of pros and cons on these. They're low cost. They have pre-existing conditions, so they're not for everybody. But they are a fit for those people that maybe don't have any pre-existing conditions and are looking for short-term coverage. And a lot of people right now might be doing that. Maybe their COBRA coverage is very costly, and they could buy a short-term plan for a lot lower than that. And again, if someone doesn't have any pre-existing conditions, they can fit. But if anybody that does have pre-existing conditions, obviously you got to be, they can be very costly if you were to move away from COBRA coverage or other individual types of coverage and so forth. But those are still out there. Looking ahead, we're kind of wrapping up here now. The one thing, that's definitely out there is the ACA litigation. This is the Texas versus Azar. Some people say versus Azar or the U.S. It's 18 states, 2 individuals claiming that the ACA is invalid based on the elimination of the individual mandate tax. Okay, like I said earlier, it's been zeroed out. So the U.S. Supreme Court originally denied motions to expedite this. It's in their hands right now. And earlier this year they said, no, we're not going to expedite it. We're not going to look at it this year. Then after that, they did agree to look at it. And they're going to look at it most likely during the term that begins to fall in 2020. So we're going to see what the Supreme Court does with this. Now, the Supreme Court already has held up the ACA twice. We all know that. And a lot of people don't see that changing. So when they look at it this fall, they'll be issuing a ruling in 2021. And my speculation is, unless there's another drastic change to the Supreme Court, and who's on it, I don't see this changing personally. Other speculation out there on what we keep hearing out of Congress or out of DC and both political parties is, I'm not going to speculate, because I don't think anything other than the Supreme Court looking at Texas versus Azar. I don't think anything's going to happen this year, because obviously we're in election year, and I think this, and with everything else is going on, I don't see any type of legislation affecting the ACA this year at all. I mean, that's where I'm coming from on that. I don't know if people disagree, but that's just a personal opinion. that said, I just want to say thank you for listening in, and we'll see if we have any questions.
Thank you so much, Pat. We are now open to questions at this time. If anyone has any questions, please type it into the questions feature, and Pat is available right now to address it. So we have a first question of the CHIP notice from the Department of Labor. Is that dependent on the size of the company, ex-employers with 50 or more, or 100 or more?
No, that has no bearing on size of the employer. So that has to be provided to all employees. And when you got two, if you have a group health plan, you got 2 employees, you need to provide that form. And we will be sending copies of slides to everybody, so you have those as well.
So I'm waiting to see if there are any more questions from anyone. And if you think of a question after the webinar session has ended, you are welcome to use the contact information Pat provided to email a question. He is happy to get any information you need regarding ACA to you. I'll leave it open for about 30 more seconds to see if there's any last-minute questions. All right, well, thank you guys so much for joining us. Again, be well during this stressful time, and if you have any questions at all, do not hesitate to reach out to us. Thank you very much. Have a great rest of your morning.
Thanks, everybody.